Hi, David Liu here, post-ULA 2022, finished a couple of hours ago. Just wanted to talk a little bit about something that came up actually in, was alluded to in the clinical highlights wrap at the end of the meeting, but actually relates to two things that happened earlier in the conference. So really, this is about oral surveillance. Now, I don't think I need to introduce oral surveillance as a study to anyone. I think we all know there's been a lot said about this since last ACR. There's been the fallout of it. I think it's probably changed each and every one of our practices in some way, shape, or form to a greater or lesser extent. Well, I think it's inevitable that there'd be some talk about this at this meeting. So data that was brought by Pfizer to this meeting that Maxime Duguedas presented on, I think it might have been on Thursday, was 0P0264, actually looked at the data from the tofacitinib registration trials all the way, so from phase 1 to 3B4 and the long-term extensions from that, and looked at the patients and they slip in with more enriched cardiovascular risk and saw how they compared firstly to those who didn't, and then also to the oral surveillance cohort. And in fact, we saw there that the signal perhaps wasn't quite as strong as it was in oral surveillance, but the risk or the outcomes in terms of MACE and VTE certainly were there. And so I think in many ways, while I think we were all surprised and shocked today at ACR, maybe the clues were there. And of course, this has been, the second thing I wanted to mention is that in amongst the new EULAR recommendations on how to, on RA therapy, of course, this has to reflect. In amongst many other things that have been reflected, the recommendation before, which recommended BDMARDs and TSDMARDs with an equal hand in the same sentence, one and the other as choices, now really ends at BDMARDs and in fact says, or could also be considered TSDMARDs, but considering the risk profile. And I think that's a substantial change, not an unsurprising change, but that probably reflects maybe how we're broadly thinking, but I think what we can expect guidelines and recommendations on how to treat rheumatoid arthritis to reflect in the very near future, whether we think it's right or not, whether we like it or not. So for more on all the fallout from this meeting, and it's been quite the meeting, been great to be back in person, head on down to rheumnow.com.